I'm Dr. Amol Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the United States to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, we're honored to speak with Dr. Debra Leizman. Dr. Leizman is the Director of Medical Student Education at University Hospitals Cleveland Medical Center and Associate Professor of Medicine at Case Western Reserve University School of Medicine. She's also the Director of the Internal Medicine Core Clerkship for University Hospitals and serves as a Clinical Director of the Case Western's Medical Science Training Program, which organizes and directs MD-PhD clinical training. Dr. Leizman is a University Hospitals Distinguished Physician and has served as faculty advisor for Case Western School of Medicine Internal Medicine Medical Student Interest Group for more than 20 years. Dr. Leizman's research interests include medical student and resident education, patient safety, and quality issues. She maintains a primary care internal medicine practice and precepts residence in the University Hospital's Internal Medicine Ambulatory Clinic. Thank you so much, Dr. Leizman, for joining us today.
Thank you for having me.
So I want to start by asking you a little bit about your childhood. Who are your role models growing up, and what were some of the values that you were imbibed early on in life that have stayed with you over the years?
Well, I would have to say that one of my most important role models was my father. My father was a dentist, but came from very poor roots. Grew up with really nothing. He was one of the first people in his family to go to college, and his aunt paid for him to go to college, and he earned his pharmacy degree so he could put himself through dental school. So he was a pharmacist first. But what was particularly wonderful about my father, and he's still living, he's 91, is his zest for life and his ability to relate to absolutely everybody and to really bring a smile and a connection with everybody he met. It was really wonderful. He also was an avid, and is still an avid reader, and would engage us all the time on different topics and ideas. And so I would say that he was really a role model for me in many respects. But I'd have to say my mom too. I don't want to leave my mom out of that. But my dad was really a true role model for me.
You know, I really like how you use the word zest. Can you describe zest in the life of a physician?
Zest is having a positive attitude, having energy to go at a tough day, a tough moment. When you wake up and you're exhausted, going at it with full vigor and freshness. When the door closes, I'm a primary care doctor, having that ability to be in the moment and make that person feel like you are there and engaged, I guess would be there. And zest is there. Something about the quality of, if you ask my dad, how's your day? His answer is always amazing. And that positive attitude to bring it to what you're doing is really special.
And did you see that translate into when he saw patients?
Well, my dad, one of the things he used to do, he used to get fresh flowers, and at the end of the week, he'd pick which patient he would give the flowers to at the end of the week. He went to lunch at 2:00 so that his staff could take lunch at 12 to 2, and because he went late, he'd always invite a patient to go with him to go eat. And so just to make them not only zest, but to recognize that they were individuals, I think was something that was really wonderful. And that connection, I really would say, I feel so lucky because I have such wonderful patients, and the connections I have with them are just amazing. And it's a pleasure to talk to them when I get to talk to them as their doctor. And I know they feel that I'm trying my best to make sure that I'm improving their health because I really care about them. And I think I learned that from him.
You know, I've taken almost 50 interviews in the last 2 months, and I've not yet heard the story of a physician who's had the courage and the dignity to invite patients to lunch. I mean, that's really something. You know, I was looking at some of the presentations that you gave to your joining internal medicine class of students, and in that presentation, there's a quote by Sir William Osler, and he says, "To study a disease without books is like going into uncharted sea. To study books without patients is like not going to sea at all." Can you take this quote and turn it into practical advice that you have learned over the years that you'd like to impart to medical students when it comes to patient care?
There's nothing like the moment that helps you bring that saying into being, because here we are at a time where our medical students were asked to step out of the hospital. and try to keep on learning outside of the hospital. I really think that medicine is learned at the bedside. And when our students were asked to be virtual, I actually created a curriculum for my students where I had them keep on interacting with patients by calling those patients who were in the hospital, who had no family by their side because they weren't allowed to have anybody come into the hospital with them, and take histories. And they couldn't do a physical exam, but they could look up their information on the computer and actually write up the history and physical and then present it to me and some other physicians by Zoom. And then actually continue to follow the patient every day, call them and connect with them and see how they were doing and work with the teams virtually. Because I just could not imagine that I could be teaching medicine where my students weren't dealing with the patients, because it's not from a book, it's from people. And they need to learn. There's no question. You need to read. You need to read. But you really learn the most by talking to a patient and examining the patient and being with the patient and putting your hands on. They couldn't put their hands on, but they could actually be with the patient and actually interact with the patient. What I love about medicine, what I really enjoy the most, is interacting with patients. We have great technical skills, and I'm not saying that we shouldn't use those, because we should, but we can't forget the importance of interaction and personal interaction.
One of the things that my dad always tells me is to go and strive for success, but make sure that you achieve success without side effects. And it seems as if in this journey of medicine over the last few years, there's been a lot of success and technological advancements, but it's also brought in a lot of side effects of poor patient satisfaction or physician burnout. What are some things that you do to keep the success high and the side effects low?
When I have a new patient come in, I tell my patient, we are going to have the doctor-patient-computer triangle. And we sit and they watch the computer as I watch the computer. And I tell them, I'm really very skilled at talking to people. I'm not skilled at the computer. So if I get stuck trying to make this screen look good, feel free to call me out and tell me that you need to talk to me. And I say to them, I feel like this is my duty, because 50 years ago, in order to get penicillin, people had to reconstitute it from urine. I don't have to do that now. I can just get it from a bottle. 50 years from now, I bet we'll just be speaking and we won't be having to type. But I have to help them get there by typing now so that we can improve the technology so that we can get there.
Many of the people that are listening in are in that phase of life where they're finishing residency and now will be starting to practice. In that role, they switch from being primarily a mentee to becoming a mentor. What advice would you have for them when they're giving formal or informal advice to students?
Be honest is one thing. Listen well. Another thing that I think is very important is try to make connections. As a good mentor, try to make connections. Like, this is somebody who has the exact same interests, or this is somebody who has children the same age. They can help you with childcare choices and options. Whatever it is, try, like I share my lists of consultants when I have young faculty members who come in. This is who I like to go for ophthalmology. This is who I like to go for cardiology. This is the orthopedic surgeon who always operates. This is the one who never operates. So I share my specialists and who I prefer.
And what about when we move from medical school into residency, right? We're still mentees, but there's this upward shift. So what would be your advice for students who are at that juncture, like myself?
I think it's in a lot of ways, it's the same thing as being able to find somebody that you can sit down and that you stop in, check in, because I think we are all, especially in academics, we're so busy and we're so consumed that we don't realize how much that extra step or taking that time makes a difference. So to say, could I come in? Can we have a moment? That really makes a difference. It's actually flattering in a lot of ways to a lot of faculty members, and they would do that even though they don't have time. That's what we're there for. We're there for students, residents, and to bring you forward and to help you get the best of what you want. And I was in residence clinic yesterday. I love my residence clinic. I love my residents. We have great residents at University Hospital. They're fantastic. You should apply. So it's not always sitting down that the moments happen. Like in residence clinic, we had, for some reason yesterday, was a slow day. And we were having so much fun. We were doing some mix-up questions because we have some third years. But using those moments about pearls, about what are you going into? We have first years, second years, third years. And so you don't necessarily have to have those formal moments. Those informal moments were fabulous. We all just enjoyed each other's company and we learned a lot about, we had some new interns, who they were, where they were from. And then the older ones, we were kind of letting them guide the younger ones. And we were also kind of pulling out in my mentoring way, like letting them teach the younger ones, but also finding out what they were doing so they could role model. It was a really wonderful environment, I have to say. And so sometimes those moments happen when you're not really in a formal mentor-mentee moment, but it was happening. And I think all of them would say that yesterday that I was a good mentor to them.
You know, one of the key things that you've said is that mentees need to be open and take the initiative and be proactive. But a lot of times mentees feel afraid. It's difficult to expose a weakness, especially in front of somebody who's going to be writing your LOR. We get so preoccupied with the thought that 4 years go by and we never really establish or get the answers to those questions. What would your advice be to somebody who's contemplating whether or not to reach out to a mentor, and when they're doing this cost-benefit analysis of mentorship?
I think getting to know a person isn't about getting to know how smart or not smart they are. It's getting to know about a person. Once you interact with somebody on a personal level, I think then they can understand, and I know you. I'm not going to judge on that. I'm a human and you're a human, and I learned about your family, and I've learned about your mother in Lebanon or whatever, who got injured in the explosion or whatever, and I'm concerned, and I ask you every time, or whatever it might be that we're talking about.
So of all the things that you've shared with us today, what's one thing that you wish you knew when you started medical school or when you started residency that you really want all the listeners to take to heart and practice?
When I was in medical school, there was an older physician. His name was Chippy. I don't know who he was or what he was. And he came and spoke to us. To me, he looked ancient at the time. So I was in my 20s. He looked ancient. He must have been in his 80s. And he came out and he said to us, when you are at the end of your life, you will not wish you had written one more paper, seen one more patient. You will hope that your family is around you, and you will hope that you have done good in the world, but you will hope to be surrounded by people you love. And I think that was really meaningful. I do tell my students what is an important lesson for myself is you have to take care of your own garden before you go out and you work on other gardens. And so making sure that your things are okay at home before you go out and save the world, I think is very important. And that's an important thing that I like to share with others. How's that?
That's amazing. You know, this was so inspiring, Dr. Leizman. I want to try to summarize a few critical insights that I'm taking away from this interview. I'd say the first thing, and which I really liked, is the word zest and the positive attitude that you learned from your father early on. And more importantly, that you recognized that people like your father played this major contribution in your journey along your way from childhood onwards. It's something that a lot of us forget along the path, and it's really refreshing to see you express that kind of gratitude. I'd say the second thing is that when we do what's right for the patient, everything else seems to take care of itself. You know, the insurance, the hospital administration. If we focus on what's right for the patient, everything else will be fine. And the third thing that I really liked is the role of the mentee and the mentor, where the mentee's job is to be proactive, to seek those meetings, to take advantage of that open door policy. And the mentor to first see the mentee as a human being before they see him as a student. So this was really inspiring. Thank you so much, Dr. Leizman, for being on with us today.
Thank you so much for having me. I really appreciate it. And I hope there's a chance you might come to Cleveland someday.
To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the Masters of Medicine.